A Tale of Two South Africas. The Double Burden. South Africa, a beautiful country with a complicated story. It's like a movie with two plots running side by side. On one screen, we see the sleek hospitals, advanced technology, and world-class specialists. This is the South Africa of private healthcare, available to the few who can afford it. But on the other screen, a different story unfolds. This is the South Africa of public hospitals, often overcrowded and understaffed. This is where the majority of South Africans seek healthcare, facing long waits and limited resources. This is the double burden of disease in South Africa. It's a country battling two wars at once. On one front, we have infectious diseases like HIV/AIDS and TB still claiming lives every day. On the other, a new enemy emerges. Non-communicable diseases like diabetes and heart disease, often linked to lifestyle changes and rising faster than ever. HIV/AIDS and TB. These are not just words, they are realities for millions of South Africans. For years, these diseases have cast a long shadow over the country. The fight against HIV/AIDS has been long and hard-fought. Antiretroviral drugs have been a game-changer, turning a death sentence into a manageable condition. But challenges remain: stigma, access to treatment, and the emergence of drug-resistant strains. TB, often a co-infection with HIV, adds another layer of complexity. It's a disease of poverty, thriving in overcrowded conditions. While curable, TB requires a long course of treatment, and adherence can be a challenge. The new epidemic of lifestyle diseases is on the rise. As if battling infectious diseases wasn't enough, South Africa faces a new threat: the rise of non-communicable diseases. Think diabetes, heart disease, stroke, cancer. These silent killers are on the rise, fueled by changing lifestyles, urbanization, and sadly, often poverty itself. Processed food becomes cheaper than fresh produce. Stress and lack of access to safe recreational spaces make exercise a luxury. These factors contribute to a perfect storm for non-communicable diseases. The tragedy is that many of these conditions are preventable, but prevention requires awareness, education, and access to healthy choices, things often lacking in marginalized communities. The healthcare divide. South Africa's healthcare system is like a tale of two cities. In the private sector, it's a world of advanced technology, skilled specialists, and comfortable waiting rooms. But this world exists parallel to the reality of public healthcare, where resources are stretched thin and patients often face long waits and limited options. This disparity in access to quality healthcare is a glaring reminder of South Africa's stark inequalities. It's a system where your postcode can determine your health outcomes, a bitter pill to swallow in a country striving for equality. The realities of rural communities. Imagine living hours away from the nearest hospital, the journey made on foot or by unreliable public transport. This is the reality for many in rural South Africa, where access to healthcare is a daily struggle. The shortage of doctors and nurses in rural areas is a pressing issue. Those who are there often work tirelessly, dedicating themselves to serving their communities. But they are fighting an uphill battle against a lack of resources and infrastructure. Mobile clinics and community health workers are a lifeline, bringing basic healthcare to remote areas. But more needs to be done to bridge this gap and ensure that everyone, regardless of where they live, has access to quality healthcare. It is prevention on paper, but patchy in practice. Prevention, they say, is better than cure, and South Africa has its share of public health initiatives aimed at preventing disease and promoting well-being. But good intentions often get lost in translation from policy to practice. Campaigns promoting healthy lifestyles compete with a deluge of advertising for sugary drinks and fast food. Limited access to healthy food options and safe recreational spaces further hinder progress. Education is key. Empowering people with knowledge about their health, the risks, and how to make healthy choices is crucial. But this requires sustained effort and investment in community-level programs. Champions defying the odds on the front lines. Amidst these challenges, there are heroes. Dedicated doctors, nurses, scientists, community health workers, and countless others working tirelessly on the front lines of healthcare. They are the heart and soul of the system, driven by a passion to serve and make a difference. They work long hours, often under difficult conditions, with limited resources. They see the impact of poverty and inequality on the health of their communities, yet they persevere, driven by a commitment to their patients and a belief in a healthier future for South Africa. Villains of circumstance, poverty, inequality, and limited resources. It's easy to point fingers, to look for someone to blame for South Africa's healthcare struggles. But the truth is, the villains in this story are complex and often intertwined. Poverty is a major culprit. It creates a breeding ground for infectious diseases, limits access to healthy food and healthcare, and perpetuates a cycle of poor health outcomes. Inequality adds another layer of complexity. The legacy of apartheid continues to cast a long shadow, reflected in the stark disparities in access to quality healthcare between the haves and have-nots. And then there's the issue of limited resources. While South Africa has made strides in improving healthcare infrastructure and funding, there's still a long way to go. The unfinished story: hope and struggle in the South African healthcare saga. The story of South Africa's healthcare system is a complex and evolving one. It's a story of challenges, yes, but also of resilience, innovation, and unwavering commitment. The fight against HIV, AIDS, and TB continues, with new strategies and treatments emerging all the time. The growing threat of non-communicable diseases is being met with increased awareness campaigns and efforts to promote healthy lifestyles. There's a long road ahead, but there's also hope. Hope in the dedication of healthcare professionals, in the resilience of communities, and in the unwavering belief that everyone deserves access to quality healthcare. This is a story that's still being written, and the ending is far from certain. But one thing is for sure: South Africa will keep fighting for a healthier future for all its people. Subscribe for more health insights, like, comment, and share. Stay informed, stay healthy. Thank you, and let's catch up in the next episode.